Neonatal resuscitation. Like in the adults, we follow a procedure in which order of assessment is from airway, breathing and circulation. In the neonates, first and foremost, temperature is noted and then we follow up with airway, breathing and circulation. This procedure of assessment has to be maintained regardless of whatever the heart rate is. Initially, tone of the baby, cry of baby and term of gestation has to be noted. If these comes out to be normal, we need to dry the baby and keep the baby with mother and start with breastfeeding. If the baby is not crying, then we need to remove the secretion by suction. The secretion has to be removed first from the mouth and then by the nose to prevent aspiration. Then we go on with airway, in which neck of the baby is put into slight extension, which is also known as sniffing position. Then we go on with tactile stimulation, in which the back of the baby is rubbed with a cotton and also sole of the baby is tapped. Even after these initial steps, if we see there is no cry, then we need to assess the heart rate and respiratory effort. If the heart rate is more than 100 and there is central cyanosis, we need to supply oxygen. We can do that by nasal prongs. And if the baby is a preterm, that is less than 32 weeks, supply oxygen by CPAP. If the heart rate is less than 100 and there is no breathing that can be seen, supply oxygen by positive pressure ventilation. That can be done by either a non-invasive or invasive method. Non-invasive method is a bag and mask ventilation, and invasive method is a endotracheal tube intubation. If even after positive pressure ventilation we cannot see any improvement in the baby and the baby's heart rate is going less than 60, we need to provide chest compression along with ventilation in a ratio of 3:1. Chest compression can be done by a 2-finger technique or 2-thumb technique. In 1 minute, 90 compressions and 30 ventilation is given, that is a ratio of 3:1 along with 100% oxygen. If there is still no response, we need to give adrenaline in a ratio of 1:10,000 of dose 0.1 to 0.3 ml per kg by a route of umbilical vein.